So I'm good. I'm recording now, and I want to welcome everybody to our Zoom presentation on adult and pediatric vaccinations. I'm really excited to be hosting this today. I think it's a very important topic, and I'm looking forward to learning a lot from our two excellent speakers today. My co-worker, Ruth Nickens, is a nurse at the Tallahassee Senior Center, and she's the health and wellness coordinator there, and she's going to be talking about adult vaccines. And then when she's finished, Dr. Paul Robinson will be talking about pediatric vaccines. He's a family medicine physician who specializes in pediatric care at Tallahassee Memorial Family Medicine Residency Program, and he's also president of the Florida chapter of the American Academy of Pediatrics. The reason we wanted to do this topic today is because at a recent GAP Advisory Council, we were talking about how during the pandemic, a lot of us have fallen behind on our vaccines, probably because everyone was hesitant to leave our homes, to go out in public, to go to the doctor's offices where who knows what COVID things are lurking. So I think it's important that we all learn what we need to do to get caught up. And so with that, I think I'll turn it over to Ruth. You want to start your screen share?
I sure do. Trying to start with the right one. How's that? Are you all seeing that?
That's perfect.
Is it big enough? Is it full screen in your view?
Yep.
Okay. Oh, great. Karen, thank you so much for the opportunity to present on this. And it's been so nice to get to meet Dr. Robinson and hear something about what's happening in the world of children. I typically only get to work with the older adults, so it's always interesting to hear what else is going on. Karen asked me to do a presentation about adult immunizations, and that's what you're going to see today. I have to confess, I do not consider myself an expert on this topic, but I am a nurse, so I know a little bit about a lot of stuff. And I think mine will be more of an overview, and then Dr. Robinson would be able to speak even in greater detail about things that you may have questions about. But yes, vaccines for adults are really important for a lot of reasons. You know, you're hearing a lot about the COVID vaccine right now, obviously. Let me see. Forgive me, I'm going to stop sharing for just a minute. Okay. I was having trouble advancing my slides.
Do you have it on the presentation mode?
No, I think I have it in book mode.
Yeah, there you go. If you put
Let's
it
see
in
if that'll do.
presentation.
Oh, see that? That's odd. Do you, are you seeing 4 per page now?
Yeah, you
My
can change it
apologies.
to a different format.
Okay.
So when you hit the
I don't know why it's doing that. This is embarrassing.
It ought to give you the option of just doing one slide.
Okay, I'm good. Is this good now? Do you see the whole presentation?
We do. You'll have to scan down with your bar in order for us to see the other slides, though, because you're not in presentation mode right now.
If you go up to the top where it says slideshow,
yes.
Click on that and
okay.
Then from the beginning and see if that works.
I don't know why. Is it? Do you see 4 slides there?
Yeah, there is a way to change that, though.
This is embarrassing. Can you stop recording for just a minute while I figure this out?
Look at the display settings. Click.
Thank you. Okay, here we go. So we're going to talk today about understanding the importance of adult vaccines. So you may ask, what is a vaccine? A vaccine is a product. It stimulates your body's immune system to produce immunity to diseases. Usually they're given by injection, but some of you may remember being given the little sugar cube with the polio vaccine on it. There's also some vaccines that are sprayed into the nose. Vaccines have a super long history. You hear a lot about them in the news today because of the development of the recent COVID vaccines, but actually experimentation with the idea of vaccines goes back for actually like almost 2,000 years. It was in the late 1700s when the first vaccination for smallpox was given. And then vaccines just sort of, marched forward after that. In the mid 1800s, Pasteur really discovered the germ theory, and then that led to all kinds of vaccines: rubella, polio, yellow fever, HIV, even Ebola. This chart is a little old and that COVID is not on here, but that really would be added to this history in 2020. So a whole lot of forward progress has been made really in the last 100 years around vaccines, but they are not new. So how does a vaccine work? This is a very simplified slide, but basically some of the weak or dead form of the agent or the germ is introduced. It sparks your body's immune system, and you create antibodies to fight that infection. And why it is so important to vaccinate is because it optimizes health. It protects yourself and it protects other people from very serious illness. And some examples of that are the flu vaccine or whooping cough. My brother-in-law in his 50s got whooping cough, which is usually a children's disease, also called pertussis, and it was extremely unpleasant. He was very, very, very ill with that. So it may have been that he had contacted somebody that had it because they hadn't had their vaccine. But anyway, it's just really important for the community, for yourself, and for your family. And why is it so important to prevent these diseases is because of the cost in terms of the dollar cost, the deaths that occur from diseases that were preventable by vaccine, the hospitalizations and the stress on the hospital staff. You lose time from work and you also impact others. Just some examples, if you look at the flu, okay, half of the people in the US get flu shots each year. When deaths do occur, 85% of the deaths are in adults 65 and older. That is why it's especially important for older adults or seniors to have their flu vaccines every year. The cost to loss of work and life is billions. So all that can be prevented with a simple vaccine. The statistic that the United States spends $27 billion annually on diseases in people over 50 that were preventable. I mean, just think about that for a minute. That is an extraordinary cost. Just by choosing to have your flu vaccine, for instance, 750 illnesses do not occur. 7.5 million people stay healthier. Over 100,000 hospitalizations are prevented. Over 6,000 deaths. So you can see quite clearly the benefits of having these available vaccinations. So what vaccines are recommended for adults over 50? And I'm going to show this to you in a couple ways because this is really what Karen asked me to speak about. It is so important to have our kids vaccinated, but it's also important for adults to remember that there's vaccines for them. The flu vaccine is always recommended for adults over 50 unless you have some kind of allergy or reason why your physician advises otherwise. For instance, my daughter is allergic to eggs. So there was a time when she couldn't take the flu vaccine. However, now they do have vaccines that are not based on eggs and she can safely take it. The Tdap, tetanus, diphtheria, and pertussis, often thought of as childhood diseases, but adults do get this. In fact, my brother-in-law. So there is a recommended vaccine for that. Also with tetanus in there, if you have an injury, you've cut yourself, you've stepped on a rusty nail, you've had some sort of wound that has opened up your skin, you want to check and see if you're due for a tetanus shot and get your booster. I believe it's every 5 years. It used to be every 10 years. I think it's every 5 years, and Dr. Robinson confirm that.
It's every 10 still.
Every 10 still, okay. Do they do it more often? If they're not sure, they'll just go ahead and give one. Yeah, okay. So keeping a records of your vaccines is really helpful, especially if you change doctors or your doctor retires and you're kind of starting over, or you're in a different city and something happens. it would be good to know what your vaccination schedule was. Shingles is another vaccine recommended for adults over 50. Shingles are really painful and unpleasant. Maybe there's some people in this audience today that have experienced shingles, but now there is a vaccine. If your doctor has not talked to you about it, you may want to ask about that. My sister, who's in her mid-50s, just had a shingles vaccine. They actually gave it to her. There were 2 doses now. It's a 2-part series. Another recommended vaccine for adults is the pneumonia vaccines. There's 2 different types, and I will let Dr. Robinson sort of expand on what makes them so different. But this is really important for adults over 50 because pneumonia is a very common cause of death in older adults, and many of these can be prevented. And this is just another, this is an age page. It's from the National Institute of Aging. And again, it just spotlights, I'm gonna say these a few times so that they'll stick in your mind. These are the vaccines that adults need, is the flu, the pneumococcal, tetanus and diphtheria, shingles, and even the measles, mumps, and rubella. It's just interesting. That is, it's generally given to children. But if you don't know if you ever had it as a child, it is recommended for you in adulthood. And this is another chart, another way of looking at it. And if you look over to the far right of the chart, I know that the text is very small, but you see up at the top in green, 50 to 64 and then 65 plus. So if you just look at the colors straight below that, that's the flu shot across the top. Yes, absolutely get a flu shot if you are able to. Tetanus, diphtheria, the TDP, you want to get that throughout your lifetime. That's what the purple means, if you have a risk factor for that. And then the zoster, that is the shingles vaccine. That's in purple. And okay, so the gray is not recommended for older adults. And then all these other ones, the hepatitis A, B, the meningococcal. Talk with your doctor. I did some overseas traveling with the College of Medicine a few years ago, and I had to have some of the hepatitis series and a few other things so that I could safely travel. So you'd want to talk to your physician if you knew you were traveling. What do I need before I go to this country or that country? So we can't really talk about vaccines without bringing up COVID vaccines. I know that in this community, we're doing very well with our 50 and older and the vaccines. I think last statistic I heard, over 75% of our older adults in Leon County had wanted the vaccine. So that would be people that were choosing to get them. There are some still people who still have not made up their mind or have some hesitancy about it. But at this time, there are 3 vaccines that have been approved, and then the AstraZeneca one is, they have not approved that for us yet. So there are 3 available. There is a lot of clinics popping up all over. In the beginning, it was hard. It was a race to try to find a clinic and to try to get an appointment, but things have really opened up in Florida. So if you are an older adult, a grandparent, and if you have not yet had your vaccine, I strongly encourage you to get them. If you need assistance in finding out where to get them or even transportation to get there, the Senior Center also has information and can help you with that. And this is just a little chart that illustrates the differences in the vaccines. The newest one being offered is the Johnson & Johnson, which is just 1 dose. It requires standard refrigeration, which makes it much easier to take into rural communities or to, to move around with it. So, and a lot of people like that because it's just the 1 dose. You don't have to go back 2 times. I had the Moderna 4 weeks apart. Many people are also getting the Pfizer. They're all similarly effective. So far, there has been 100% of all the vaccines, prevention of serious illness, hospitalization, or death. That is astounding, and that is what we're aiming for. Just because you've had a vaccine doesn't mean you might not get a case of it, but it won't be serious. You're not going to get sick and you're not going to die from it. And that just gives so much relief and comfort as we start to move around in the world again. Some of the reasons we've learned that people have not gotten the vaccine or are waiting is because there's a lot of mistruth, misunderstandings, miscommunications around the vaccine. So this little slide just clarifies some of those. And I got this one from the Bond Community Health Center right here in Tallahassee. So one of the myths is that it was rushed and it isn't safe. The truth is we've been studying this kind of vaccine for many, many years, and they went through all the proper procedures. And it is, although people are having side effects from the vaccines, these are normal, expected side effects, and you get over them in a couple of days. Other people think it changes your DNA. That is simply not true. It's impossible for a vaccine to change your DNA. It can give you COVID. The vaccine that you're given does not contain a live virus, but you do create immunity to the disease. So while you may get some symptoms, some achiness, some headache, maybe a fever, chills, sore arm, it did not give you COVID. Your body is creating immunity to it, and that is the reaction. It can cause serious side effects. Yes, it can, but it's extremely rare, and most side effects are normal and expected. And then another misinformation that's circulating is that it makes women infertile, and there's not any evidence at that time to support that. And of course, if we're specifically targeting adults with this information, it's not even relevant to them. So right now, the eligibility has opened wide up. Yay for Florida. So now anybody over 18 years of age can receive the COVID vaccine in Florida. So that is really good news. I know those of you that are raising your children, have children younger than that in the house. They are continuing to do studies about that, but the most important thing at home would be to just practice good, safe protocol. So, you're not transmitting it one way or the other. So that's it. If you have any questions, you're welcome to ask them now, or we can save them till after Dr. Robinson's and just ask them all at one time. Karen, was there anything
Does anybody have any questions?
I would like to ask a question. If you have never had chicken pox, do you still need to get the shingle shot?
It's highly recommended if you've never had the chicken pox. Yes, it's recommended even if you have had the chicken pox.
Okay. And
It would be, yeah.
Go on.
No, I'm done.
I think the first slide when you gave the definition of a vaccine, you said that it should prevent you from getting the disease.
Mm-hmm.
But then we hear that it won't help keep you from getting the disease. It just make it, less for you. So
in the case of COVID, and I'll let Dr. Robinson address that too. In the case of COVID, they are finding that you can contract a case of COVID. It's a very contagious disease, but it's not going to be serious. For the childhood vaccines, that's not the truth, right, Dr. Robinson?
Well, so when we do vaccines, one of the things we find is there's so many percent effective, right? So the vaccine is, let's say, 80% effective. What they're saying is 80% of the time, if you get this vaccine, you are not going to get the infection, period, even if you're exposed to it. And then there's a 20%, because you got to go all the way to 100. So 20% of people who get this 80% effective vaccine could actually get the infection, but the vaccine would still make the infection much less severe than it might have been. So using influenza as an example, from year to year, the influenza vaccine is about 50 to 55% what we call efficacious or effective in preventing influenza. But 80% of people who die from influenza from year to year are people who have not had the vaccine. And only 20% of people who have had the vaccine die. What that means is if I get the flu vaccine, even if it doesn't prevent me from getting infected, I'm one of the 50% who still gets infected, I'm not going to get near as sick. Does that help?
Yes.
Okay.
That's a really good answer. So in a large portion of the people, they don't get it, and that small percentage is a milder case.
One
Thank
more
you.
question and I'll be through. If you have gotten one vaccine like the Pfizer, and the next time, like next year or whenever you're supposed to get it again, do you have to get the same time?
Well, you should get the second vaccine generally within 4 weeks. It's a little bit different for each one, but definitely within a 6-week window is what I have learned. So you generally want the same one. The research about mixing and matching is still kind of up in the air. We're not doing that. We're not mixing and matching. People are getting the second vaccine same as the first. Dr. Robinson, what would you say about it? It's probably wouldn't do any harm if someone had to do that, but we're not really setting up the clinics that way.
Yeah, I'm gonna predict, and I may be absolutely wrong, but I'm gonna predict that within 6 months they'll say it's okay to mix and match. But they're still researching it, and they haven't come out with the final answer yet.
Yeah. Good questions.
Thank you.
Now, there has been some talk that the COVID might require a booster. And I'm wondering, I wonder if that's what Flossie was thinking about. If we have to do a booster in a year from now, is it okay to mix the two different kinds?
We ought to know by a year out.
Yeah,
Right. Time will tell.
there's probably no way to tell right now.
And just a quick comment about affecting women's fertility. How in the world could anybody possibly know if that's an issue in a vaccine that was just started in December? That we don't have, there's no way to, I mean, that you can tell that that's got to be malarkey because there can't be data on that yet.
Right.
I did hear they are doing some research around that, but there's no outcomes yet.
So before we move on to the pediatric, I remember there was a question that arose at one point when an older person, a senior grandparent, wants to be around infants. Are there any vaccinations that you need to get? I'm assuming that that's where the MMR and the Tdap boosters, that you need to be up to date because those are what you would normally get as a kid, but I don't know if either one of you have.
They recommend that grandparents of new babies be given the Tdap for the pertussis. That's actually going to be in my talk.
Okay. All right.
And unfortunately, with every pregnancy, which is kind of a pain in the neck. So if your child has 3 babies 2 years apart, you get to get it 3 times. That's the current recommendation anyway.
Wow.
And we'll talk about why when we get to pertussis.
Great. I want to add one more thing. The conversation I had with Dr. Robinson last night, we were talking about, he works with children and it's all about making sure the kids are, keeping up with their immunization schedule. But as we get older, our physicians, that is not a priority for their patients. So just to remember, it's really up to you as the patient to advocate for yourself and to ask your doctor about the vaccines you're hearing about. Should I have this? Well, if so, when should I have it? So just ask, be proactive in your own health and ask your physicians which immunizations you need to have.
All right. Thank you, Ruth. I guess, Dr. Robinson, you're up. You need to unmute. You're still on mute right now.
Okay. So now we're going to switch and talk about kids' vaccines. And I hope that you guys feel free to stop me if you don't understand something. There are some pictures in here. It occurred to me that people who are not doctors might find difficult to watch because I have some pictures of some pretty bad illnesses. So feel free to close your eyes if it does cause trouble. So the objectives would be to review a few of the major vaccine preventable diseases. Thankfully, Ruth talked about influenza and mentioned polio. There's no way for me to talk about all of them in 20 to 25 minutes. So I've just picked a few of them to go over. I want you to understand the definition between eliminated and eradicated when it comes to public health in terms of some of these diseases. and understand why some of these diseases are still around today. And then finally understand what herd immunity is, which to me is the funnest part of the whole talk. I don't have any competing interests. I don't have any income from pharmaceutical companies. I'm just I'm actually a pediatrician, not a family physician, but I teach family physician doctors. So if you look at what are the common vaccines that we give children in the United States? Obviously, if you live somewhere else, there are other vaccines. You can see there's a huge list here. I think it counts about 16. Diphtheria, pertussis, tetanus, measles, mumps, rubella, polio, rotavirus, pneumococcus, Hemophilus influenza, the two of the three hepatitises, chickenpox, HPV, influenza, meningococcal disease, and then COVID-19. The Pfizer vaccine is okay down to 16, and within a few months, I expect they will go down further to around 12 or before that. And then smallpox is on here, but we don't give that vaccine anymore because it has actually been eradicated. So in public health terms, eradicated means it is gone. It's never coming back. The only place there's left smallpox in the world, there are two of them we know of, one in Russia and one in the CDC deep vaults. So the first one is Clostridium tetani or tetanus. This comes when children step on a rusty nail. The bacteria lives best in very low oxygen environments. And so it goes in to the foot or whatever cut you have that has dirt in it. And it can actually, this produces spores, and then the spores basically become more active bacteria, and they produce a toxin that attacks all different parts of the nerve cells. So it causes you to have trouble breathing. It causes very terrible discomfort in the neck and contractions of muscles all over the body. And people can die from this because they have difficulty moving their respiratory muscles. This young man has a classic thing on his face called rhesus sardonicus, which just means kind of a sardonic smile related to that. Thankfully, tetanus, as you can see, from 1947 to 2018 has decreased markedly to almost none. There have been about 264 cases of tetanus in the United States over the last 10 years. Most of those cases occurred in people from 20 to 60 because, especially guys tend to be boneheaded and do stupid things. But realize that 25% of tetanus cases occur in people over the age of 65 in the United States. So it's still out there if you let your vaccine wane and you step on a rusty nail. I should also note in third world countries, a major form of tetanus occurs in newborns if the germ gets into the umbilical stump in unhygienic conditions where they're born. This is a girl with a condition that first started as a sore throat, and she had some fatigue and sore throat, a little bit of respiratory symptoms, and then developed swollen glands. And in the back of her throat, when the doctor looked, she had a very thick white membrane, and it's Corynebacterium diphtheria or diphtheria. It's a bacillus or a bacteria germ that was given its name in 1826. It's Greek for leather or hide. Thankfully, there have only been 2 cases in the United States between 2004 and 2018, but there have been lots of cases seen in Colombia, Haiti, Venezuela, even in 2019. So it still occurs, unfortunately. Untreated, 50% death rate. Even with the best treatment, 10% of people die from this germ. So it's a nasty germ. The next disease is extremely contagious. There were 1,282 cases in the United States in 2019 in 31 states, including Florida. 128 people were hospitalized. 61 had complications, including inflammation in the brain and pneumonia. And 73% was linked to an outbreak in Rockland County, New York, among Hasidic Jews who did not believe in immunizations. Now, interesting thing is that this disease had been announced to be eliminated in the year 2000 in the United States. Eliminated means there's no disease in the country or region for a period of 1 year. So for the 1 year period before 2000, no one had seen any of this infection. It's a viral infection. You get a high fever, fatigue, cough, and runny nose, and then your conjunctiva get red and inflamed. And a rash forms about 14 days on average after exposure. 1 to 3 days before the rash, there's a little rash that comes up on the inner part of the cheek that people often miss. And people are contagious from 4 days before to 4 days after the rash. Does anybody know what this infection is? Very infectious, causes a terrible rash. It is measles. So measles is just a nasty infection. I thought I'd had it. I spent most of my adulthood telling everyone that the sickest I'd ever been in my life was when I had measles as an 8-year-old. And then TMH made me get my measles titer, and it was negative. So I had to get an MMR booster. So I now don't know what that infection was that made me so sick when I was 8, but I thought it was measles. So in the decades before the measles vaccine was licensed in 1963, there were 549,000 cases and 495 deaths reported every year in the United States. 40,000 hospitalizations, 1,000 people per year with chronic disabilities. And the actual number could have been as high as 3 to 4 million. These are all data from the Centers for Disease Control, by the way. So here's just the number of measles cases reported by year. It'll be in the handout. You're welcome to look at it. Notice the big bump in 2019 with the community in New York that people didn't believe in vaccinating. The next illness was very common up until the time my kids were born. When I was an intern at Vanderbilt Hospital in Nashville, we admitted probably 1 to 2 children per call night, which was every 3rd night, with this infection. It caused, the little kid on the left has what we call buccal cellulitis. The little kid on the right has a preseptal or periorbital cellulitis. These are all caused by bacteria. It can also cause infection in the epiglottis called epiglottitis. This is a classic thumb sign on a lateral x-ray of the neck. And you can see that this is a normal epiglottis with normal airway, and this is epiglottitis. So obviously these kids die of suffocation if they aren't treated very appropriately and quickly. And remember, I used to admit one of these every 3rd night when I was at Vanderbilt Hospital as an intern. And the vaccine came out in 1987 for Hemophilus influenza B or HIB. And I have not seen a case in 25 to 30 years. It just disappeared because of the vaccine. So this was a major cause of death and disability in children in my age group. It was probably the same for us as diphtheria or polio were for my predecessors. And we pretty much eradicated it because of the vaccine. Now, Hemophilus influenza is an interesting name, because it was founded by a group of people from a group of people with influenza in 1892. And in 1892, no one had described viruses yet. So when they looked under the microscope, remember, we were just talking about Koch discovering the bacteria. That was in the mid 1800s. So they saw the bacteria under the microscope and they thought that was the cause of influenza. And so that's how Hemophilus influenza got its name, which was a mistake, but it held on, so it's still called that. The next one I wanted to talk about is the cause of the 100-day cough. This is a young child with this condition. In the 20th century, this was one of the most common diseases and a major cause of childhood mortality. Before the vaccine was manufactured in the 1940s, there were more than 200,000 cases annually in the United States. The vaccine has caused a 75% decrease in infection. That's still a pretty high rate if you look at it. This is a very finicky gram-negative bacteria germ. It requires all these special media to even grow. It attaches to the respiratory cilia and produces a toxin that paralyzes the cilia and the airway, causes inflammation of the respiratory tract, and you're not able to get things up and you start coughing. And this is, of course, pertussis, Bordetella pertussis, which causes whooping cough. This illness can be deadly to infants. It is a pain in the neck. In Ruth's, I guess, nephew who got it, who was in his 30s. Was it your nephew or cousin? In people that are 30 and above, you know, in older people, it's a pain in the neck because you cough for 100 days. Well, you cough for a long time. You feel terrible. It's just it causes this cough that just we call it a paroxysmal cough. And it's very infectious. But in infants, what happens is when they cough so hard, they can actually quit breathing and they can develop hypoxia or lack of oxygen to their brain, and they can end up with seizures or even die. So pertussis is a deadly illness to infants. Just to go through a few of the other ones. This isn't that child, but I remember in Columbia, Missouri, when I was teaching at the University of Missouri, I had a young man who had presented with a sore throat. He went to the emergency room in a hospital in our community in Missouri, and his pediatrician recommended a throat culture. They did a throat culture on the child, and it was negative, so they sent him home. Nobody examined him to look for these little red spots. And 2 hours later, he was in our hospital, and 4 hours later, he died. This is overwhelming meningitis and infection caused by this particular germ. It is horrible. One of the great fears all pediatricians have when kids have fever. It's why your pediatrician probably asks you, if you call them at night about your child having fever, they probably ask if there's a rash. And they're asking that because they don't want to miss this particular germ. Varicella, chickenpox, most of the people on this call have had this. I certainly remember having it. My own son, who helped me with the computer when all this started, got the chickenpox on the airplane. He broke out with the rash on the airplane as I was going to Washington, D.C. to take my oral pediatric boards. So he infected a good number of people on the airplane, I'm sad to say. Causes these nice little red blister lesions. It's a fairly benign infection in younger kids, but in adolescents and adults, it can be deadly because it's associated with pneumonia, which can kill you. Note that they recommend the varicella vaccine at 12 to 15 months, and then at 4 years along with the MMR, and then the Shingrix vaccine at 60. And it's, again, as noted by Ruth, it's a 2-dose series at 0 and 2 months. The Shingrix vaccine is a dead or killed vaccine, and it's more effective than the old Zos. Rubella is the 3-day measles. It usually comes on as a very mild infection in most adults. It's nowhere near as bad or cause you to be near as sick as measles as a rule, although it can still rarely cause inflammation in the brain. But the problem with 3-day measles is that if you are an adult and you develop rubella in the first 12 weeks that you happen to be pregnant, your infant can be born with congenital rubella syndrome, which is a horrible illness that affects vision, mental development, and causes birth defects. It's a horrible disease, in infants, and it's one that we want to prevent by getting the population immunized. That's why when women are pregnant, one of the things they always check is rubella. Just to note, hepatitis A, another vaccine, a germ that we vaccinate for. Notice that there's been a big outbreak in Florida in the last year. We usually give that at 12 months and then 6 to 18 months later. And so now we're going to turn to a little bit of discussion of herd immunity, which is kind of my favorite part of the talk because it's kind of fun to understand. So obviously herd immunity, not just for sheep. So I have to introduce you a new term. It's called R0. It's the basic reproduction number. And what it is, it describes the average number of secondary infections that'll come out of a primary case of an infection, assuming that everyone is entirely susceptible. So you have an unimmunized population, and the R0 value tells you how many people that you get exposed to. If you have, say, rubella, how many people that you get exposed to who have never had the illness or the vaccine are likely to get sick. It's calculated using some pretty heavy calculus that I certainly don't understand. I'm anxious to let my mathematician son have a look at it. He would probably understand it. I dare say no one else on this call would, including me. But it's a very helpful thing. It's used all the time with pediatric infectious disease doctors. So this diagram, just if you look at the top one with all the white circles, this is an R0 of 4. So that means for that first circle there on the left top, if that person gets this infection, then that means 4 people that he comes in contact with are likely to get infected. And then each of them will infect 4 more. And then on from there, 4 and 4 and 4. So you see how fast infections can spread. An R0 value of less than 1 usually will not turn into an epidemic or a pandemic. An R0 value of more than 1 will often do so. And we're going to go through some of the R0 values of some of these infections in a minute. So now let's look at the B part of this slide, the lower part. You have the person with the infection that has an R0 4. He, instead of being able to infect 4 persons, of the 4 people who might have gotten infected, let's say 3 of them are immunized. So they're immune, they're in the gray circle. So only 1 of the 4 people that would have been infected gets infected. And then that person is also exposes 4 people, but 3 of the 4 that he's exposed to are also immune, so he only gets 1. So you can see how herd immunity works. It basically prevents people from getting infected. And in fact, it can even be helpful to people who have not had a vaccine. So for example, I have had a child in my office with leukemia who can't get the measles or the varicella vaccines, but if he gets either of those infections, it could kill him. Well, he's protected by all the other kids in society who have had their measles and varicella vaccines because it's less likely he will be exposed. So these are the R0 values of a few of the conditions that we've just talked about, and some we haven't. Tetanus doesn't really have an R0 value because you get it from stepping on, a dirty nail or getting dirt into a wound. But notice that measles has an R0 value of 12 to 18. It is one of the most infectious illnesses we know. If you have measles and you walk into a bedroom, and then you walk out and someone else goes in an hour later, they can develop measles if they're not immune. Mumps is also greater than 12, but not quite 18. Rubella or German measles, also very high. Rotavirus, which is a major cause of diarrhea in young infants and children, very high. Notice that influenza on the right side only has an R0 of 3, so not near as infectious. And then COVID at this time is thought to have an R naught of 5.7. I'm honestly not sure whether that includes the new strains of COVID or not, but you can see it's much more infectious than regular influenza. Also have R naughts for human papillomavirus. That was actually calculated in the paper I'm going to show my son. So I don't know if those are absolutely correct, but if someone has HPV, their R naught's about 1.2 to 4. And then hepatitis A about 2.1. You can see some of these numbers. So it's kind of fun understanding kind of what this means and how infectious different things are if they get out into the community. And of course, why are some of these things still present? Well, unfortunately, we have, as you know, a large population, and some might say growing population of people who are against vaccines. And so when people do not vaccinate their children, then what happens is that herd immunity goes down, and things like measles are better able to spread into the community and get us sick. I'm not going to bore you by asking you to look at the CDC immunization schedule, but there will be a handout that you can click on. You can click on a link to go to my Dropbox account, and you can download this presentation in a PDF format, and you can click on this and look at it as much as you'd like for vaccines. And then just to finish my talk, just kind of an interesting fact that my mathematician son calculated. So if you had earned $150,000 every day from the day Christ was born until right now, you still would not be as rich as Jeff Bezos is. Pretty amazing. And that's all I got to say, I think, unless people have questions.
Very interesting statistic there at the end.
Yeah.
Thank you very much for that.
Yes, thank you for everything. That was very informative. I certainly learned a lot.
I have a question.
Yeah, go ahead, Lossie.
First of all, why for children, do you think that it's going to be a time or now something that they're going to require the kids to take COVID shots like they do, the other vaccines? And if not, why not? And then another question is, I saw that the youth sports in Florida has caused the kids' infection rate to go up in the last week or so. And and that's very concerning to me, because as we speak, I think my granddaughter is on the way to play a basketball game. And I don't know, what do you do in those kind of situations? I know I could just say don't go and something like that, but should something be in place to, say that, if the rate's going up high, that it shouldn't, you shouldn't be participating in that, maybe from the school board or something like that? Or is it just an individual parent decision to do that? Because she'll probably be hard to deal with if you say no to her not going and everybody else is going and she's trying to get a scholarship to college. So
Yeah.
what do you do in a situation like that?
So to take these in order, I do believe that the vaccine will be down to age 12 and maybe even below that before the end of 2021. That's just my mythology. I may be wrong. Now, I think it's going to be highly recommended by your physicians, but remember, in order for it to be required by the state, the legislature has to make that law. So your immunization schedule that, you hear people say to their pediatrician, I only want the ones that are required. Well, those are the ones that the legislature has decided should be required. And some of them, like hepatitis A, are not on that list because the legislature hasn't decided. The other thing is, remember, when you have a Republican legislature, they believe strongly in parent right to choose, and they're likely not to pass a law. So I think it'll be something that will be highly recommended, but in Florida, I doubt it will be by law or required. In terms of your daughter, one of the things that pediatricians have been astounded at, if you Google FCAAP white paper, just for chuckles, when this all started, a group of us from the Florida chapter wrote this long paper and sent it to the governor saying it's not a good idea to open schools because of the fear of what will happen to children. And we did that based on the fact that every infection known to humans, children are what we call super spreaders. They catch it easier and they spread it better than adults. Now, for reasons none of us completely understand, that does not appear to be true in COVID. Younger children seem to get it less and spread it less. Now, your daughter, who's a teenager, is getting into adult age, and so they start approaching adults in terms of the risks. I do believe the school boards have kind of been running what happens with the sports. So I don't think you would be left on your own to make a decision if the rates went way up. I think the Leon County School Board would react appropriately.
Okay. So if she's doing it, is proper, and we
I
can.
think they're really trying to do what's right. They're having close discussions with the Department of Health. Scott Rifkes, who's a Surgeon General, is a good guy. I know him. He's a pediatrician. He's going to do everything in his power to make sure people are safe. Our governor, is more into parent rights and more into opening up the state for economic reasons. I was very concerned about that, but frankly, he was right and I was wrong. It turns out that kids did not get sick at the rate we thought they would. So, we can argue whether it was still appropriate for him to make those decisions when he did, when we didn't know, but he was right and I was wrong. That's the bottom line.
Okay, thank
If
you.
I can just interject something here, and that is with the new variants, they do seem to be affecting children more than others. And one thing your granddaughter could do is use safe protocol. She could wear a mask as much as she is able to. She could try to stay socially distanced and from the others. I mean, hopefully they're all doing that, but with teenagers, it's hard to control what they do all the time. So you could really encourage her to do what she can to protect herself.
How old is your granddaughter?
17.
Oh, so she could actually be immunized. She can get the Pfizer vaccine.
Oh, really?
Yes. The Pfizer vaccine is safe down to 16, and it's going to be, and early data from younger children is very positive. But yeah, she can get it. Especially, I mean, you could probably make a case for the fact that she's an athlete, and does she have asthma or anything like that?
She has asthma.
There you go. Got an athlete with asthma, higher risk, needs to get it.
Yeah, so Lassie, you can talk to your doctor, your pediatrician about that. I think the health department as well as FSU also does Pfizer vaccine.
Okay.
FAMU, I believe.
I called the pediatrician, and she said she's not giving it now from her office. So I just.
Yeah, but TMH gives it. Has your daughter ever been to TMH? Is she a patient there?
Yes. She just had ACL.
If she's been there, if someone will contact me, I can go into her chart and put in an order. Put in a referral.
And at this time, since it's now, sorry, my name's Alexis. I work with the marketing team at TMH. And I've been working really closely with some of the vaccine clinics that we've been doing here. So if you were interested in scheduling an appointment to get the vaccine at this time, since it's now open for 18 plus for just the general population, and then for Pfizer 16 plus, the only thing that you really need to do is go on to tmh.org/vaccine. And you can make an appointment to attend one of the vaccine clinics and pick a time that's best for you. Typically, I think the first doses are on Thursdays. And then from there, because she is under 18, all that you really need to do is fill out a little bit of paperwork, which is also on that website.
Thank you.
And yeah. TMH is so efficient. They do it over the Gasvini Center. It's a drive-through vaccine. Everyone who's been through has been really impressed.
That's great. Any other questions? It's at 1 o'clock. Don't want to keep Dr. Robinson and Ruth too long, but I do want to thank you both so very much. This was an excellent presentation. I'm sure everybody got a lot out of it, and I will be sharing this with all of the GAP participants so we can watch it again and everyone can watch it and learn a lot of important information. So thank you both very much for taking time to talk to us today. I'll give one last opportunity for questions before we wrap it up.
Can we send out the link to my handout to people in case they want to download it? I
Sure.
don't know whether it go in the chat box or whether to send it to their emails. If you,
So
if
Alexis has already sent me the link to your PowerPoint, so I can share that and everybody can get it off of your PowerPoint, right? I think I
yeah,
saw.
it's actually a PDF, so it's not everyone has Office probably. So it's a
Okay.
PDF. Mhm.
Okay, great. All right, well, I guess that's everything. Thank you so much for coming. Everybody have a wonderful weekend.
All
You
right.
too. Thank you so much.
Thank you
Karen.
so much.
Nice to see all of you.
Bye.
Bye.
Thank you.